Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale metropolitan area. Today I'm out at the Packard Stadium, which is the home of ASU baseball for now. It was built back in the 1970s. I don't know what it cost back then, but I do know that after almost 40 years of playing baseball here, it needs some repairs. Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale metropolitan areas. Today I'm out at the Packard Stadium, which is home to ASU baseball, Arizona State University. One of the best teams in the country. They've won 5 NCAA titles, and they've produced almost 100 Major League Baseball players, including Barry Bonds, Dustin Pedroia, and the like. The team started playing here in 1974, and at this point they are in the process of signing a deal with the Chicago Cubs to play over in Mesa starting in about 2014. That would be a 30-year deal where the stadium costs about $84 million, and the proposal right now is that ASU puts up $2 million. So that's about 2.4% of the actual cost, which to me is an awesome deal for ASU. The topic for today is spinal cord stimulators and how you go from A to Z, meaning how do you become a candidate for a spinal cord stimulator, how do you get approved for a spinal cord stimulator, and then what's the process of going through those hoops. Well, a spinal cord stimulator is a very good procedure, but it is a last resort. It's not something you get done as an initial procedure when you first start developing chronic back pain. So basically, here's a few scenarios. If you have chronic back pain and you undergo a back surgery, and I'm not saying it fails, but let's say it doesn't get rid of all of your pain. Let's say it's 50%, okay? So you're left with 50% of your pain, and it's still disabling. You're not able to work as much as you want, enjoy life as much as you want, can't play with your children like you want to, those types of things. What do? Well, you can go to pain management, and there are indications for chronic narcotics. You can have physical therapy and rehab, chiropractic treatment, epidural or facet injections, things like that that can be extremely effective. At a certain point, those may get you to be as functional as you want, or the patient may still be in a situation where they're just not quite as functional as they would like. Now, keep in mind, a lot of this is subjective. It's very difficult for a doctor to objectively say, this is how much pain you have or are supposed to have. Patients react to pain differently. Studies show that all the time. So if you have also a surgery that was initially successful for, let's say, spinal stenosis, and you free up all the nerve roots that are being pinched, and you free them up, take away what's compressing them, and scar tissue comes back over some of those nerve roots, the patient may develop pain down one or both legs that doesn't go away. No matter what you do, if you do another surgery to take out scar tissue, what comes back? More scar tissue. So at a certain point, more surgery is not indicated, and the patient is left with residual pain in one or both legs that bothers them every day. That is a good indication for a spinal cord stimulator. If the patient has leg pain plus some back pain, a spinal cord stimulator can help with some back pain. So those are very good indications. But the overriding principle is that a spinal cord stimulator doesn't fix anything. It is simply a big Band-Aid, proverbially, that goes in the back, and it works all the time. It changes the way that the brain perceives pain signals. And it changes basically a pain signal for a tingling type feeling, and it can make the pain drop down significantly. You might need less narcotics, less injections, you might need less time off from work. It can really make a big difference in someone's life. So here's what I did. I drew up basically how a spinal cord stimulator works. It's indicated not just for leg pain, we're talking about low back now, okay? Not just for leg pain, but also for back pain, because it has been shown to help with patients' back pain. Now, it's also, like I mentioned, for scarred nerves, where you have scar tissue develop around one or multiple nerves. It's also good for diabetic neuropathy or peripheral neuropathy. That's when patients have a burning, tingling pins and needles feeling in their feet that can get some help with medication, but there's no real surgical answer outside of potentially like the Dellin procedure for podiatry. Those can help, but it is an indication, okay? Well, here's the way that it works. It starts out with a trial, and in a trial, a patient comes in, and as an outpatient, they get a lead put into their back with a little electrode on the end, not the full one, but a little one, and the patient's awake during the procedure, sedated but awake. And the doctor will say to the patient, they'll turn it on and they'll say, does that help tingle the area of where you're feeling the pain? And if the answer is yes, that's where it stays, and then the lead comes out of the skin into a battery, okay? And that is not too difficult to get approval for if other treatments have failed. Then that stays in for about 5 to 7 days, and there's a dressing on the back, and the lead comes out to the battery, and you can change the programming. But after about 5 days, it comes out in the office, and the patient is asked, how much of your pain did that relieve? If the answer is greater than 50%, typically there is an indication to go on to the final implant. And oftentimes before that is accomplished, the patient will need a psychological evaluation to get insurance approval. Okay? So there are a few hoops to jump through. But once you end up going for the final implant, that is all internal. Nothing comes outside the skin. So you have a large paddle, and I did this because these little dots are diodes. And those diodes are what carries the electrical impulses around the spinal cord. Then the lead travels underneath the skin, and the battery pack, which is about the size of a hockey puck, goes underneath the skin subcutaneously, either in the abdominal area off to the side or on the buttock area just above it so you don't sit on it. Okay? So that can help dramatically, and that stays under the skin permanently. And the electrode paddle is around the spinal cord, and that can be programmed tons of different ways to help with pain in one or both legs along with the back. Those used to be that you couldn't recharge them. They just lasted for a few years and then died and had to be replaced. Now you can actually have rechargeable ones where the patient actually wears a belt while they're sleeping every few nights, and that recharges it. So there you have it. The spinal cord stimulator can work extremely well. Overall, the studies show around 60 to, I think newest studies show about 85% effectiveness, which is very encouraging. So if you are in a bad situation, you've had a surgery that either worked well and failed or didn't work well, and you're not a candidate for another surgery, a spinal cord stimulator may be for you. Lots of information on our website at preferredpaincenter.com. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.